With much of the COVID guidelines being relaxed, day by day, there are thousands of Americans who feel the COVID pandemic is never ending for them. Hello, and welcome to another edition of COVID Conversations. Each week, we bring the medical experts directly to you to help you make the best decisions for you and your family. I'm Harold Fisher. There is still so much health experts are learning about COVID and its possible lingering health problems. One of the biggest issues is COVID's impact on the heart. Joining us today to talk about COVID and our heart is Dr. Clarence Findley. He is a cardiologist. Dr. Findley, thank you so much for joining the conversation.
Absolutely. Thank you for having me.
Absolutely. So let's start off here. What are the possible heart issues for those who have contracted COVID and perhaps beat it, but are still having issues with their heart?
I think those are it's a good way to step this off. We're all aware of what tends to happen or transpire in the acute phase or the time when you've recently been infected. And so, it increases the risk of things like heart attack, things like potential heart failure, things like certain arrhythmias. But then, you'd expect some of that to kind of resolve as time goes on. And by time, I mean, once the acute infection resolves, generally within 1 to 2 weeks, you should see sort of the disappearance of some of those symptoms. But something that we're actually seeing is, just like you've alluded to, the long haulers of these COVID patients who tend to exhibit symptoms for weeks to months afterwards. We're really kind of targeting that 2 months out to about 6 months out time frame from the initial infection. We still have some patients complaining specifically of chest discomfort, some shortness of breath, palpitations, so feeling like their heart's racing a little bit. And then if there's a very small minority of patients which will go on to develop heart failure. And those patients, obviously, they're complaining of swelling in the legs, increased fluid on their body, shortness of breath, and also some chest pressure, chest heaviness. So those are some of the common complaints we see among the long-term COVID patients.
Is it possible that these patients may have had heart issues before contracting COVID and not know it?
That's absolutely possible. And when you look through sort of the flu literature, we see some of the same things. So individuals actually, if you test their blood shortly after they're infected with just the flu, some patients will actually have expression of a certain protein that we can detect in the blood, which tells us whether or not they've actually had a heart attack. And we see that quite commonly. And there are a variety of reasons that you can have a heart attack. It can be an actual blockage in the heart arteries. It could be just general stress on the heart. But we do see that in the influenza literature and in influenza patients. And so a lot of that has been extrapolated out. And we've seen the same thing here in COVID patients for them to have signs and symptoms of actually having a heart attack. However, it's generally difficult for us to tell whether that, when we get in there and actually take a look, whether that disease was present prior to the COVID infection or something that developed as the COVID was taking place. And so I think that question is a little bit more difficult to tell, but suffice it to say that we are picking up some patients who may have had something that they probably didn't know before when they do get infected.
For those who did not have any heart issues, who knew that their hearts were healthy, and then after they contracted COVID-19, and afterwards you mentioned palpitations, what is that a sign of? Is there anything within the COVID infection that causes that?
Yeah, I think that can get a little tricky because there are multiple causes, and a lot of it is conjectures. We've been dealing with this for, the better part of 2 years now, going on 2.5 years or so. And so a lot of the information is new. What we do know is that they have palpitations. Palpitations are oftentimes a sign of abnormal heart rhythms. And the most common abnormal heart rhythm associated with the long-term COVID patients is something called atrial fibrillation or atrial flutter, which is an abnormal heart rhythm that kind of predisposes patients to going on to developing stroke. And so if you notice as a patient that you're having palpitations and it's lasting for, a better part of a week, it's not remitting, then you may want to touch base at least with your primary care physician and see if you can get either an EKG or some form of heart monitoring to get a better sense as to what's going on. And
Is there any way? I'm sorry, go ahead, please.
No, you're fine. So by palpitations, I just mean a sensation of your heart either skipping a beat or having an extra beat come in. Patients can sometimes feel something different in their chest, and that's really what I'm referring to, almost an extra thump, if you will.
How do you treat that?
So I think most of us would probably not actually treat it. If it's just a palpitation that's not the atrial fibrillation or atrial flutter, if it's just an extra beat coming in from the heart, we'll kind of say, let's just watch it, let things die down. But if it's a scenario where we've actually determined that it's atrial fibrillation or atrial flutter, then we may get into scenarios where we're starting certain medications to help dampen the frequency of these palpitations. Also, it is possible that we'd put you on a medication to try to convert you back into normal sinus rhythm. And then the other thing we do, based upon a risk scoring system that we have, might consider even putting you on blood thinners to minimize your risk of stroke. And so that's just something that I think needs to be evaluated if you're having extended periods of these palpitations, just to ensure it's not one of the things that's worrisome and predisposes you to the development of other issues that you would probably like to avoid, in particular stroke.
Is it more likely that someone could have a heart attack after COVID? Those long haulers.
Yeah, and I've read some articles that have come out, particularly from sort of our European colleagues, that has been conjectured, sort of or questioned. We don't have enough data to suggest one way or another. We do know that during the acute infection, there definitely some patients, particularly if you have the right set of comorbid diseases, meaning other diseases like diabetes and high blood pressure, et cetera, are at higher risk for having a heart attack. Once you get out of the acute infection phase and things have been treated and you're sort of transitioned to that long-term COVID patient, I don't know that there's any data to really suggest that you are at increased heart attack in that scenario.
I have several anecdotal examples of how long haulers have moved through this disease. There was a lady who was on my show on the Daily Drum, and she contracted COVID in the summer of 2020, and for a year, and this was someone who was fit, who was active, but I remember maybe 6 or 7 months after her body had been cleared of it, she was still having issues walking down the street, climbing steps. Just at one point, she said she walked about a block from her house and then had to sit down because was too weak to walk back. Now, here we are for her, probably not quite 2 years since contracting COVID. She is back to some semblance of herself. In other words, she's back to exercising as she did before, rigorous exercising, walking again, up and down the steps, going out again. Have you seen long haulers recover fully or almost fully after contracting it? This isn't the end of the world kind of situation. What's your opinion about those long haulers who eventually have returned to a full sense of health?
Right. I would say that she is sort of an extreme example. When you look at the literature, most patients, generally when they get out to about 6 months, most of those patients have fully recovered. Okay?
Mm-hmm.
Obviously, you don't expect after acute infection to still be having symptoms 3 months later, but we do see it out to 6 months. And as time goes on, the percentage of patients drops. I think it drops down to something like somewhere between 2 to 5% of patients who actually develop long haul are still having symptoms about 6 months out. So she clearly is an extreme form. And it makes me wonder whether there was more underlying just a shortness of breath, whether, she should have been evaluated just to be sure that there was nothing more than just kind of this, long COVID, that there wasn't any heart failure or any other things that we get concerned about in that setting associated with her symptoms. But, I think one of the beautiful things is that she has recovered. She's
Yeah.
able to get back to normal life. And so for that, obviously, I'm sure she's thankful, and we're happy that she's in that position. Um, and again, this is all, I can have one or two patients that have done well. Most of the patients that I know have recovered generally within 3 months. I haven't had any of the long haulers, but when you look through the data, there are examples of these folks even pushing out past 6 months. And I don't know that we know what percentage of these folks fully recover versus not recover if you're still having symptoms out in the 6 month range. Again, that's open for study for sure. But my concern in that patient would just be to watch her, to ensure that she continues to improve over time. And then any signal that she's slipping backwards, that's someone that I would pay, I'd be a little bit more aggressive in her workup in terms of ensuring that there's nothing else going on that we need to be paying attention to. So she would, someone who's that far out would definitely be on my radar screen to watch and ensure she continues to do well.
Now, what about children with COVID? Is it possible that they could also have heart issues?
The pediatric literature, I would say it's a little bit harder for me just because I'm an adult cardiologist, and I must say I haven't paid attention to the pediatric literature as much. But what we do know, obviously, is that kids from the very initial strain of the COVID were less infected. As these strains have become a little bit more muted in their potential to harm patients or kill patients or have long-lasting effects on patients, right? So when we look at the initial versus the Delta versus the Omicron, we see some more increased infections in the younger kids, and I don't know if that's just because they're back at school or what the factors there that are contributing. But it does seem that they're catching it more, and before was the kids are not really getting it and they're not necessarily being harmed from it. But I think in this scenario, I would say that it's a little bit difficult for me to make comments about the pediatric population just because I don't study them as much.
What do I do if I suspect that I'm having heart issues, COVID or not?
You definitely should see your primary care physician as a first stop. I hope that you've established care with the primary care physician longitudinally over the course of years. Definitely go see a cardiologist, and a primary care physician, and they'll start the workup. They'll start an EKG. They'll ask you questions. And if there's concern there, then they'll forward you on to a cardiologist who will then take things from there. And then it becomes, for me, I always pay attention to family history, any risk factors, diabetes, high blood pressure, lack of exercise. So not having sort of a strict exercise regimen, any individuals with high stress, job scenarios, et cetera, they tend to also have a lot of unwanted effects from cardiovascular disease when you combine it with just sort of a stressful lifestyle. So those individuals are individuals that I would target. And if I'm concerned that maybe something's going on, we could consider a stress test. There's some patients who you'd have to prove it to me that they don't have it, meaning my suspicion is so high that I would send them in and try to get a workup going faster. We wouldn't really stop with a stress test. We would go straight and look at their heart arteries with a cardiac catheterization. So suffice it to say, establish good care with a primary care physician. Make sure you don't hold back. Tell them your symptoms, and then they'll refer you on to where you need to go.
I think that's a great place to wrap this conversation up. But I did want to share with you that we really appreciate you, Dr. Clarence Findley, a cardiologist, for giving us some insight into COVID and heart health. I don't think there can ever be a time when we have too much information.
Would definitely agree. And I just appreciate you giving me the time to come on and talk to your listeners, let them know what's out there, how they can try to handle these scenarios as they arise. Don't ignore it. Definitely get it addressed. You think you have COVID, someone is in the house that has COVID and you are starting to exhibit symptoms, go get tested. And then from there, that kind of starts a clock. Pay attention to your symptoms, touch base with your primary care physician, and then go from there. These are, thankfully, it's not a death sentence anymore. We're in a scenario where we have treatments for this disease. And so remember that as we go forward, do the best you can to keep yourself and your family members safe.
Dr. Findley, thank you so much.
Take care.
And thank you for joining us for another edition of COVID Conversations. Make sure you tune in every Wednesday at noon as we take you beyond the politics and the fear and to the medical facts about COVID. I'm Harold Fisher. Have a safe and healthy week.